This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, senior attending here, and I'm joined as always by our research fellow.
And I'm Dr. Alara. Today we're looking at a fascinating new study from the Journal of Infection in Developing Countries, set to be published in 2026, titled Utilizing Metagenomic Next-Generation Sequencing to Diagnose Central Nervous System Infections After Craniotomy.
This is a topic that hits home for any practicing neurosurgeon. When we talk about postoperative care, few things are as high stakes as central nervous system infections. Even with the best sterile techniques, the risk of bacterial meningitis post-craniotomy remains a significant concern.
Absolutely. The paper highlights that these infections pose a massive challenge, specifically due to the high morbidity and mortality associated with bacterial meningitis. For residents listening, we know that timing is everything. If you miss the window for appropriate antibiotic coverage, the outcomes can be devastating for the patient.
Right. And the current gold standard has its limitations. Traditionally, as the study mentions, we've diagnosed these infections through clinical signs like fever, neck stiffness or altered mental status, and cerebrospinal fluid bacterial cultures. Alara, in your experience in the lab, what are we seeing as the bottleneck with those CSF cultures?
The issue is often sensitivity and time. Cultures can take days to yield results, and if the patient was started on empiric antibiotics before the lumbar puncture or the drain sample was taken, the culture often comes back negative. This study addresses that exact gap by evaluating the clinical value of metagenomic next-generation sequencing, or mGNS.
Let's dive into that. For the medical students listening, mGNS is a bit of a shift in how we think about diagnostics. Instead of trying to grow a specific organism in a dish, we're looking at the genetic material directly.
Exactly. The objective of this study was to evaluate the clinical value of mGNS specifically in diagnosing CNS infections after craniotomy. Unlike traditional methods, mGNS allows for a broad, unbiased detection of pathogens. In the context of this paper, it's being looked at as a way to potentially bypass the limitations of those standard CSF bacterial cultures we just discussed.
And that's critical because post-craniotomy patients are a complex cohort. They often have multiple reasons for systemic inflammation: steroid use, blood in the subarachnoid space, or even just the trauma of the surgery itself. Distinguishing chemical meningitis from true bacterial meningitis based on clinical signs alone is notoriously difficult.
Precisely. The authors emphasize that because the morbidity is so high, we need a diagnostic tool that is more definitive. By utilizing mGNS to diagnose these infections, the study aims to show whether we can achieve a more accurate and perhaps faster identification of the causative agents, compared to waiting for a culture to grow.
It's an interesting shift toward precision medicine in the neuro-ICU. If the mGNS can pinpoint the pathogen even when the culture is negative, we can transition from broad-spectrum empiric therapy to targeted antimicrobial treatment much sooner. This not only helps the individual patient, but also plays into our larger goals of antibiotic stewardship.
It also addresses the reality of neurosurgery in various healthcare settings. Since this was published in the Journal of Infection in Developing Countries, it highlights that the need for advanced diagnostics is global. Whether you are in a high-resource quaternary center or a developing region, the mortality of post-op meningitis is a universal problem.
So the takeaway for our residents: while clinical signs and CSF cultures remain our baseline, we need to be looking toward these molecular techniques. This study provides a foundation for how mGNS can be integrated into our diagnostic workup for the post-craniotomy patient.
It's about moving beyond just suspecting an infection and toward proving it through genomic evidence. It'll be interesting to see how this changes the standard protocols for post-operative fever workups in the coming years.
Well said. That's all the time we have for this episode. For those interested in the specifics of the sequencing depth and the comparative sensitivity, I highly recommend reading the full text in the Journal of Infection in Developing Countries.
Thanks for joining us. We'll see you next time on the Neurosurgery Hub podcast.